Hi you guys, it's Lily and my sweet cat Jax is just casually kneading on my lap. I have been almost a NICU nurse for 1 year now, which is really exciting, in a level 3 NICU. And I just in this video want to talk about like NICU related things. Maybe you got a new job, you're starting off, you're gonna have your clinicals in the NICU. Let's just kind of like do an intro to what NICU life is like. So the NICU stands for neonatal ICU, and you are going to be working with babies, which is such an awesome patient population. So obviously babies have parents, and that is a big part of working in the NICU is communicating with parents, educating parents, especially if they're first time parents. I said parents a lot there, but it really is important, the education that you give to them, because some of them, this might be their first baby. So in the NICU, you can expect to find babies in 2 different kinds of beds. One is just a regular open crib, and the other is an isolette. It's basically like an incubator where the babies that are under a certain weight requirement will stay, or if they have temperature needs or some temperature instability, they will be in the isolette, and it will adjust the temperature necessary to what their skin temperature is, which is really cool. Very expensive, very fancy machines, very cool stuff, and you'll get acquainted with one if you start working in the NICU. So let's talk a little bit about skin to skin, which I love to talk about because this is so good for the babies and they love it. Obviously, if a baby is really preterm and on a ventilator, that's probably not an appropriate thing to do. But when a baby is, healthy and stable, skin to skin is such a great option. And that is when the parent takes their shirt off and you place the baby skin to skin onto their chest, and the babies love it, and it's so good for them, their brain, their vital signs, and it really just helps with bonding, producing breast milk. There are so many benefits to skin. So you will likely be helping parents do that with their babies. So newborns sleep a lot, and that is really important for us as nurses to promote sleep for these infants and rest, because their brains and bodies really need it. And we do this by clustering care at certain specific times. So we will go into the patient's room and change diapers, do a little assessment, get vital signs, feed them in a cluster of time, and then a few hours later we will do it again. And it kind of usually, for different patients, you're like, okay, I have 3 patients, but typically they're on different schedules is how it will work. Or you may have to switch a schedule. Next, let's talk about bath time. One of my all-time favorite things to do in the NICU, actually, objectively my all-time favorite thing to do in the NICU, is give newborns baths. It is so precious and tender and sweet, and they love it. Except when they don't, but usually they really like it, especially when you do the head massaging. So you're always gonna get a temperature before giving a bath, because babies can lose heat really quickly, and if their temperature is too low, you're not gonna wanna give them a bath because that could put them at risk for getting cold quickly. So you're going to check a temperature before and about 30 minutes after a bath to ensure that they're warm. If not, they may need some extra temp support, a hat on, or wrapped in a warm blanket. So for bath time, obviously you're doing it with a stable baby. You're gonna get a basin of water, warm to touch, just, what feels comfortable to you is probably what's gonna be comfortable for them, not too hot, not too cold. And you can either, put them in the water, unless they have an umbilical cord that you have to really try to avoid getting it wet. So that would be a sponge bath situation. And then you just rub them down with, soap, the Johnson & Johnson. It smells so good. And the baby might cry and get upset at this part, but then you get them all swaddled up and then do a head rub with the shampoo, and they love it. They love it. Something I also recommend doing is double checking with parents and asking them if it's okay if you give them the bath. It's their first bath, because they may want to be present for that. It's a special event that they, want to give their baby their first bath or something, or at least see it happen. So double check on that. Let's review some lingo that is used in the NICU. NICU doctors, the neonatologists, are referred to as neos. So you might be like, oh my God, where's the neo? I can't find the neo. That's what that means. Don't get that confused with the neo puff shown here. That is at the baby's bedside that could deliver breaths to a baby. Now the isolette that we were referring to earlier has a few different modes that are notable to you. So there is air temp, skin temp, and then the heat shield. So the heat shield would just be when the top is off and it is either delivering heat to the baby, or it could be turned completely off. Skin temp is a mode that you will use on these smaller babies who need some temperature support or stability, and that will be when you take a probe connected to the isolette, place it on their body with a little sticker, and it will monitor the baby's skin temperature temperature, and you will set a number that you want their skin temperature to be, and the isolette will know whether to make it hotter or cooler based on the baby's temperature. Pretty cool. Then the baby can graduate to air temp, which is where you take the skin probe off and just set a temperature that you want the isolette to remain, and the baby will just exist in that temperature. There's a lot more terminology to it. You'll learn it as you go along, and I'm happy to do more. I have some on my TikTok. I'm gonna wrap this video up. It was not a cohesive outlined video or thought process. It kind of just was me spitballing things that I spontaneously thought of. So I hope it was helpful to you. If not, keep it to yourself. If so, comment and like below, and I hope it helps. Tell me what you guys want to see, what you want to hear and learn about. So thanks for watching.